I just made one edit to one of the cases, so I will repost it so that the MMT score is appropriate. But we will say this is my case. I flipped over my card. My patient is a 75-year-old who had a left THA, or total hip arthroplasty, 2 days ago. When I entered the patient's room, found the patient supine in bed. I'm supposed to sit the patient up at the edge of the bed, transfer them safely to a wheelchair. The patient has 4 to 5 strength in both upper extremities, BUE, and 5 out of 5 strength in the right lower extremity, RLE. Is everybody familiar with this type of abbreviation?
Yeah.
Right, left, lower extremity, or bilateral upper extremities. Okay, so I will just talk you through it. My thought process here, I see THA, we talked about it earlier. As soon as I see that, I think standing assisted pivot transfer with a front wheeled walker. Okay, that's a gimme. Should be an easy one for you to select. Based on that, I know only one leg is affected, so I'm going to choose the long sit method for bed mobility. So I would give my grader those answers, and then I would go forth and do a practical. So if anybody would like to be my patient, just get a pillow. All right. So we're going to start
It's your
with
time,
supine.
Quadzilla.
Quadzilla. All right, where it is. So we've got, everyone's scene will be set up exactly the same. You'll have a wheelchair, you'll have access to a slide board and a front wheeled walker at your station.
Scabarolio.
You will be expected to bring your own gait belt. Your wheelchair will be set up. You'll have one chair for demonstration. Actually, no, we'll give you 2 chairs for demonstration. And I'm gonna raise the patient up.
Cheese, Vincenzo.
2 like paisanos.
Alright, so
10 years later.
I'm gonna grab 2 chairs. The reason you'll have 2 chairs is a subtle encouragement to demonstrate. Okay, the chairs are there for a reason. Please use them. Because if the patient's in bed, I can't jump into bed and show them the transfer.
Scoot on over.
But what you can do is have it here, and here's the wheelchair, effectively. Okay, so you'll enter the room. Before you set anything up in the room as far as moving the bed, whatnot, we expect you to go through an informed consent. Talking to the patient, hand sanitize. Next lab that you're here, you will cover informed consent. Okay, every step of what you're going to tell the patient. Okay, but I flipped over my case. I told my grader what I want to do. He said, "Go ahead." I'm going to wash my hands. Come in. Good morning. Good morning. I'm Trevor. I'm from the University of St. Augustine. I'll be your occupational therapist today. How are you feeling? Very good. Okay, so I know 2 days ago you had that left hip arthroplasty, and let's change it to a right just for constraints of the environment, okay? So your right hip was replaced 2 days ago. How's it feeling?
Painful.
Okay, so my goal today is to help teach you a technique to get you up out of this bed, get you in the wheelchair safely, and hopefully you have some pain relief with that, and you gain some independence with your mobility. And it's good for your lungs and your body in general just to be up and moving after the surgery, okay? If that doesn't sound okay to you, during this you might feel more pain, you might feel a little dizzy during the process, but I'll be there to help you. If that doesn't sound like something you want to do today, there are alternatives to this treatment, but I think the best thing for us to do is to work on your mobility, getting you up out of bed, getting you in the wheelchair for the day. Does that sound like something you'd like to do today?
Yes, sir.
Okay. Do I have your consent to continue?
Yes, sir.
Okay, that's my informed consent. There are 8 attributes. They are all be covered next lab. Okay, so I've got consent. I'm gonna proceed to get everything ready so that the patient is ready. So the wheelchair or the bed is locked. I'm gonna touch both hospital beds. I want you to check, lift up the bed rails, make sure it's locked. You can also kind of nudge it to make sure it's not gonna slide. Okay, my patient had a right hip replacement. So I know we're gonna use the walk around method. We're gonna sit up at the side of the bed here. That would be his right side is affected. So I know we're gonna transfer to the strong side. So the wheelchair should be right here, but I need to make sure it's out of the way so that the patient doesn't kick it with his legs. So I'm gonna move it, thank you. Move it back here, that way once we sit up, I can pull it into position where I want it. I know I need to get these out of the way, but close enough to where I can access them. Armrest is gonna stay on for this type of transfer. And I'm gonna grab your walker for you. How tall are you?
5'11".
Are you still setting up?
Yes.
Okay.
Yep, so as long as I haven't moved the patient, you're good to proceed and get everything ready the way you need to. Obviously, the patient needs to be in a safe position.
Is that part of our 15 minutes?
It is.
Okay.
Yep, so as soon as I usually start the timer after you give me your answers, I say go ahead. Okay? If you take too long deliberating on what transfer, what technique, I may subtly tell you your timer starts now just to kind of speed it up. But I will give you a minute or two to think. You can have a sheet of paper if you so choose. Some students find it helpful to kind of brain dump on the paper if you need to write things out. All right. So today, in order to get you out of bed, what I'm going to be doing is supporting that right leg, the one that had surgery. I'm gonna have a hand on your shoulder. I'll ask you to come up onto your elbows, up onto your hands. Make sure those fingers face back away from you. Your left leg is gonna bend up with your foot on the bed. That way you can push and pivot. And I'll support the affected leg. We're gonna pivot to the side of the bed at your pace. Once we're at the side of the bed, I'll lower you down so your feet touch the ground. And then from there, we're going to be standing up with our walker, okay? I don't want you to grab the walker when we stand up. What I want you to do is, actually I'm gonna kind of do this camera and
That's fine.
with you to watch. Oh, not ideal, but I'm gonna put this in front of you. Ideally, the patient should see what you're doing, but I'm going for the camera. Sorry, patient. All right, so I've got the walker in front of you. Your wheelchair, because we're going from bed to wheelchair, I know I want the wheelchair about a foot in front of me because we're taking a step forward. So what we're gonna do is, you're already gonna have a gait belt on. I'm gonna put it on you here in the bed. I'm gonna have you slouch forward, kind of slide to the edge of the bed, and then you can sit forward. What I want you to do is push from the bed. The right leg is gonna be slightly in front. That way it opens up that angle of the hip. And then we're gonna stand up on 3. 1, 2, 3. Once you come up, you can grab the walker, slide that right foot back. So we're gonna take a step forward with me. I'll be on your right side. You're gonna be walker, right leg, left leg. Now we're gonna start turning to the right. You're gonna turn your right foot out, turn the walker, turn the left foot. Turn the right foot out, walker, left foot. And then we're gonna start stepping backwards. You're gonna start with your left foot, right foot, walker, until you touch the wheelchair. Left foot, right foot, walker. From there, you're gonna slide that right foot forward again, reach back, and sit down into the chair. And then I'll give you your arm rest, or your leg rest back on, and we'll be all done, okay? Can you repeat that back to me? You can just say yes.
Yes.
Okay. So that's a requirement. To make sure the patient hears and was understanding what you're doing, you're gonna ask, but do not expect them to do it, okay? Just say yes for time's sake. All right, so the patient can repeat that back to me, so we're good. I already have his consent to continue. I get everything out of my way. Keep the walker nearby so that it's ready for us. First thing, before I put hands on the patient, I need to make sure he knows what hip precautions are, okay? Has anyone gone over hip precautions with you? The answer is always no. Usually we're the first ones to do it, unless you have a really good surgeon.
So maybe they already broke them.
Maybe, and that's the risk. Usually we're in pretty quick, day of surgery, but sometimes we're not. So hip precautions, there's 3 things we're not allowed to do with that right hip, okay? And what that is no bending your hip past 90 degrees. So this is 90. We can't lean forward past 90. We also can't lift that leg past 90, okay? The other thing we can't do is if you're laying in bed, don't cross your legs. And we want to keep those legs next to each other. And then those toes on that right foot, we want them to face the ceiling, okay? Don't let them turn in towards your other foot. Again, you repeat that back to me, you'll say yes, and then we'll continue.
Do the mock people know to just say yes, or do we tell them you can say
I will
yes?
instruct them. That way they don't ramble on with everything you said and waste 5 minutes. Okay. Okay, so my wheelchair is ready, walker is ready, and we are going to proceed. All right, first I'm gonna take your pillow. Bed height, I'm gonna raise up so that it's based on the therapist height.
Does it matter if you put the gait belt on supine or seated, or?
So, obviously this type of patient should be able to sit at your bed, but for consistency, we're always just gonna, if they're in bed, we're gonna put it on in bed before we're seated, because we have to have that contact.
Okay.
Okay. No gait belts on you right now. Do you mind if I borrow this one?
Nope, no, no.
Thanks. Okay. So again, we're letting go of the gait belt, make sure it doesn't hit the floor. We've got the teeth side. All right, I'm gonna slide this gait belt behind your back. If you can arch your back for me. Tuck the excess gait belt into the belt. All right. So my wheelchair is ready, my walker is here. I'm gonna have a hand on your shoulder, go ahead and come up onto your elbows. Good, up on your hands, face those fingers back behind you. I'm gonna support this leg, I want you to bend this leg up, put your foot on the bed, okay? And we're just gonna go at your pace. So, I'm gonna rotate. And notice how I'm leaving this leg kind of down, I'm not letting him hike it up to break 90 degrees. Here, I'm gonna let that knee bend, nice and slow. Okay, you can let that knee bend. Good. He's here, he's leaning back. If he hadn't done that, I would instruct him to lean back on those hands. You feel okay? Yes, sir. Okay. I'm gonna lower you down to your feet touch. Because we're a hip patient, and I don't want us to break 90, I'm gonna keep the bed height slightly higher than I would for another transfer. So right about there is fine. When the time comes, I'll have him slide forward. Again, about a foot away from the bed. Lock the wheelchair. I'm gonna turn the caster wheels. All right, bring your legs together a little bit. All right, patient's right leg is affected. They have a hand here. You can slide yourself forward. Start with your hips going forward first, till your feet touch the floor, and then you can bring your shoulders forward. Okay, so we're gonna stay seated right now. So we're here, lean forward slightly. That way I can reach his gait belt. I have my AP stance. We're gonna stand on 3. Try to lead with your hips and then grab the walker. 1, 2, 3, up. Good. How you feeling? Good. Okay. So first thing, we're gonna move the walker forward. Move the right leg forward, left leg forward. Now we're gonna start turning towards me. We're gonna start with that right foot. Turn the toes out, move the walker, move the left foot. Turn the right toes out, walker, left foot. Now we're gonna start stepping backwards. Step back with your left foot. Right foot, walker. Left foot, right foot, walker. Can you feel the chair with both legs? Yes, sir. Slide your right foot forward slightly. Reach back for the chair and you can sit. Good, he's all the way back in the chair. I can have my trunk control off. I can be here in front of the patient. I can reach my leg rests. All right, go ahead and put this foot up. So this one I don't want to lift up to break 90 degrees, so I'm just gonna extend our knee. And then we can come up to here. And we haven't broken 90, we're okay right there. You feel okay? Yes, sir. All right, here's your call bell, we're all done.